Hi, I'm Alex Howard. You're watching Conscious TV, and today my guest in the studio is John Wilks. John is a practitioner and teacher of craniosacral therapy, and today we're going to be talking about craniosacral therapy, having an overview of the subject. But before we come to that, John, maybe tell us a bit about your story and how you kind of came to work in this area.
Okay, thanks, Alex. Well, it's quite a long story. I started when I was about 18, I suppose. And I read an amazing book by Arthur Yanov, you might have heard of, called The Primal Scream.
Okay.
And it really fascinated me. It sort of it talked a lot about how trauma is stored in the body and how you can work with it physically to release it, really. And at that time, I was going through quite a hard time myself, and I thought that sounds fantastic. So
It's quite a young age to kind of come to that kind of thing.
Yeah, but it sort of set me on a quest, really. So I actually went to live in a therapeutic community for a while, for about 6 months, and they did a lot of this very sort of primal work, very sort of physical, screaming and shouting and bashing pillows and also.
15, 18-year-olds are kind of.
Well, I know. Well, by that time I was about maybe 20, I suppose. Okay. So I got very interested in how the body stores trauma and how you can kind of work with that. And then from then I explored all kinds of different kinds of therapies over, I suppose, about a 15-year period. And then I came across craniosacral therapy after that. And it seemed to be, what I was looking for was a kind of safe way, really, of working with trauma and held trauma in the body, and a way of releasing it and being able to move on, I suppose. And actually, so in the meantime, I tried lots of different things, and some were safer than others, it seemed to be.
Well, it's quite interesting that you started off with almost kind of primal scream and the really kind of physicalized kind of ways of working with it. And as we'll talk about in a bit, kind of craniosacrals are almost the opposite of that in some ways. It's much more subtle kind of way of working. So was it just a process of just following what you felt drawn to? I mean, how did you kind of navigate that path?
Well, I at the same time, was slightly after that, when I was about 21, I got very, very much involved with meditation. And that was a sort of different kind of path for me of dealing with the same sort of stuff I wanted to do with myself. But it was a way of going very, very still and very deep. And also what I found by doing that through sort of various meditation practices was that actually my body responded really well to it, that I felt much more integrated doing it, and my whole system felt calm, and not just in the mind. It was a very physical sensation as well of well-being, I suppose.
Yeah.
And so I was also looking for something that sort of integrated that, that could bring that to a therapeutic setting somehow, that maybe I could do with people by putting my hands on them somehow, that would induce a very deep sense of stillness and connection and a sort of being at peace, I suppose.
Because I get with meditation, there's obviously a lot of work that goes into finding that state, and I guess by doing things like craniosacral, giving someone an experience of that, like opening a door almost to show them the state that it's possible for them to be in.
Yeah, and that's very true with craniosacral work. It's a very meditative thing, both for the client and for the practitioner. Ideally, it's not doesn't take much out. Well, it's very engaging. Because you're very much with the person when you're treating them, but it's also very, very beautiful, and very peaceful. Most of the time.
Yeah, and just before we come to more about it, I was also interested in reading in your bit of your background that you also had a previous kind of quite a career but of experience in music and that kind of thing, and I was curious that I guess that there was a relationship between that and your own process with it.
I think music or any kind of artistic thing, but particularly I suppose music, you when you're playing you have to listen as well, very intensely to what's going on around you. It's like playing in an orchestra. You're hearing the flutes or the clarinets or the violins. So when you have your hands on somebody, it's like it could be completely cacophonous. You could feel all kinds of different things going on, different rhythms, different emotions, different sensations when you have your hands on somebody. So like with the training in craniosacral therapy, a lot of it is actually trying to identify what you're listening to, whether it's a physical thing like a pull through the musculature or the fascia, or it's much more subtle, like you might get a feeling of an emotional response to to what you're doing, or some trauma, or whatever it is. So it's being able to differentiate those things out, and then how you work with it.
Yeah,
so
it's very interesting. Yeah, so that previous background was effectively developing that ability in you, and I guess also in you that there's a certain level you get, there's a certain state you go into when you're performing and playing and that kind of thing as well, which is kind of similar to the meditative state and that
it's
kind
very
of thing.
Focused.
Yeah,
you have to be very focused.
Yeah,
and again, a lot of the training that we do in craniosacral therapy is how to develop that internal listening space, I suppose you could call it, where you kind of take a step back a little bit, and you allow whatever is happening with the client to come forth.
Yeah, because in my understanding, that's quite a big difference between craniosacral work and other forms of body work, where often things like chiropractic work, for example, there's quite a lot of manipulation, there's quite a lot of kind of physicality to what's being done, and there's from my own experience, having experienced craniosacral, there's a subtlety to it which is actually very powerful, but it's, as you were kind of describing, it's more of a listening and an engaging from the practitioner as opposed to a kind of doing to the body. And I'm curious more about that.
Yeah, I mean, with a lot of therapies, I suppose particularly things like chiropractic, where you go for a session and your posture is analysed, and maybe they might do an X-ray, or it's very physical, isn't it? They might do some orthopedic tests to try and identify where the root of your problem is. Because if you have a neck ache, it might be related to something that's happening in your lower back or your sacrum or whatever it is. So that's a very analytical way, which is very useful as well. But with craniosacral, there's, I suppose, less of that. I mean, obviously one is using all one's senses when one is with someone, so you are observing them and things like that. But when it's much more to do with when you put your hands on, that their body will begin to respond. It'll become much more clear then where kind of the root cause of their condition is originating from. So it's very much led from them, and that's often quite unexpected. It's like the body will try and prioritize what it wants to deal with during that half hour or 3/4 of an hour that you're with them.
And I think it's sometimes difficult people who are in a more traditional scientific mindset. They're looking for things that can be measured on instruments and that kind of thing. And I think sometimes to understand the subtle energies is not always so easy for people. How do you explain that to people? This concept of an energy system and these inner rhythms and that kind of thing that are going on.
Yeah, I mean, there are certain physiological things you can talk about in craniosacral therapy. We talk about different tides or expression of different tides in the body, which you can feel. I mean, there's a classic one which is about 10 to 12 cycles a minute. Okay. Which is kind of like an ebb and a flow, and a lot of craniosacral therapists cite the work of Dr. Sutherland and Upledger and people like that, who, for example, if you watch a spinal operation, where the outer layer, which is called the dura, which is the membrane that surrounds the spinal cord, and underneath you have fluid basically, and if you watch that, you can see that there's a kind of an ebb of the cerebral spinal fluid, this fluid that surrounds the spinal cord, sort of going up and down, and that it's very much like if you're like by the sea, and you're on a fairly smooth sandy beach, and you saw the tide coming up, and it goes whoosh like that, and then back down, and it has a similar kind of speed actually. Okay. So that's a very physiological way of explaining it, and then that in itself has a knock-on effect with all the other structures in the body. For example, the bones of the cranium, or the sacrum, or the vertebra, or even the joints and the various tissues in the body. If you put your hands on someone in various places, you can feel that expression of these tides, which feels kind of like an expansion and a contraction. So sometimes it's described as a flexion or extension, or an expansion or contraction, however you want to describe it. So that's a physical thing which you can feel as a therapist.
And is that something that anyone can feel, or someone learns to feel?
Yeah, you can. I mean, often when we do intro days, we do a day or sometimes a 2-day course. And because I tend to teach mostly people like midwives, that and who have quite good hands-on skills already. But even if you get someone off the street who's not really used to this, by the end of the first day, they can usually feel these tides going on. It's not impossible. They think, oh, I never going to feel it.
I imagine that's also probably quite a powerful experience for people to experience that. This idea that they can tune to someone's subtle energies and actually have a sense of that.
Yeah, definitely.
And
we tend to not trust our own perception. I think in our culture we're almost taught not to trust our own, aren't we?
Right.
I mean, you find this when I teach people like midwives, that almost that their intuition, they have to disregard their intuition because they have to stick to the rules and they have to do this.
Yeah.
So after a while, you tend to disregard that, which is such a pity, because most people can feel these things. It's not hard, and they kind of intuitively know these things. They know about how to negotiate space, with somebody, what's comfortable, what's not comfortable, and different kinds of touch. They know when someone, if you put your hands on someone, you instantly know whether it's a friendly touch or it's aggressive touch, or it's a sexual touch, or you know what I mean, or it's a therapeutic touch. You do know. Everybody knows this.
Yeah, it's a very good way of putting it. And I think it's interesting that a lot of us tend to trust things that we can see on the outside, and learning to trust that inner knowing, I think, is very valuable. It's interesting also, you mentioned training with midwives, and I know you do quite a lot of work with babies and that kind of thing.
Yeah.
And I'm curious as to how actually they respond to the concept, but also exactly how you're working with babies, and why it's valuable.
Well, I feel it's my passion, actually, to be honest, about working with babies, because if they respond so well, and you don't have to do very much with them at that time. I mean, we're talking about anywhere from a sort of week old till they're toddlers is a really ideal time to work on them. Kind of the earlier the better, but not too early. But certainly after a week is great, and you can see them respond to your touch, and it's a very, very particular thing that they will express. They may try and express physically what's happened with their birth and try and resolve that. For example, if they've had a cesarean section, or they've had a forceps or suction or whatever it is, and you can kind of see them do that, and you can see them letting go of stuff, and the result is that they're much more settled. So it's not something that you're it's not a placebo. It's a very definite change. And the mum will say, oh, the baby's, thank God, it's sleeping through the night and it's feeding better, or so there are very, very clear physiological changes that happen in response to this work, which is great.
It's interesting that you mentioned the birth process, because I think society's perception is, birth is basically get the baby out of the mother. That's what they're thinking. And you mentioned certain forms of birth, like cesarean section or through forceps and that kind of thing, which, from what you're talking about, can actually be quite harmful to the baby sometimes. And I'm curious as to what that process and how that happens.
Well, in terms of birth, I think we know much more now than we did 30 years ago about how the baby perceives things and how it remembers things. So because babies do remember everything, actually, but they remember it much more on a sort of gut level than necessarily a conscious level. Obviously, if I asked you about your birth, you wouldn't remember, consciously, but your body remembers.
Right.
Your body remembers. Right. And
I've actually experienced this. Is interesting. You mentioned this is a kind of aside, but I had the experience once under hypnosis. I went back and re-experienced my birth, and it was just a side. It was very interesting that I had this sense of my father walking out and leaving. And that's actually what happened in my birth.
Yes, I'm sure.
So it's
all there.
It was the memory was there.
Yeah.
And to go back to my mother and check that out, and she was completely spooked that I was able to remember that.
Yeah.
And obviously this affects people through their lives if these things aren't healed and they don't work. It's
such a powerful imprinting. Up to the point of birth, the baby is sort of very nicely cocooned within the mother. Floating about. It's all very happy, and you know what I mean.
It's kind of unconscious bliss, effectively.
Well, it is. Hopefully, yes. Everything is all right, and then when it goes through, the contractions start. It's a very physical thing, and then obviously as the baby comes down the birth canal, it's squeezed. It is, no doubt about it. It's squeezed a lot. Its head is squeezed. Its body is squeezed. So it's a very, very physical imprinting that goes on at that time, which is very important, and can be difficult as well. So if you have, for example, the neck as the baby comes down the birth canal has to twist and turn a bit in the natural course of events. So it gets a lot of compression. If you imagine it's sort of being pushed down over a period of hours, probably. So if for example, if the baby's induced, that's a much rougher ride for the baby. It's quite uncomfortable for it, really. If the midwife or the obstetrician uses suction, for example, or forceps, then of course the baby's head is designed really for compression. If you imagine, everything is squeezed, the neck is compressed. But if you get this suction cap, as they might do in probably 10% of births now in the UK are born that way, you get a suction cap applied to the head and the baby is pulled out. You can imagine the neck is not designed for that pulling and twisting, and the head is not really designed for that, and the base of the cranium here is not designed for that. So that has physical implications.
Sure. I guess at that point the body is so fragile and is just developing that it's much more, I guess, easily damaged for one of a better way of putting it.
Yeah, it's you can get physical distortion patterns which can affect the jaw, the development of the jaw, the bite, can affect this area, the temporal area, for example. You might get. I'm talking about very physical ramifications like headaches, migraines, neck ache.
And these could be things someone's experiencing in their adult life, right? As a result of what happened
yes, definitely. I mean, we know, for example, that the way the jaw forms, that the hard palate forms in response to sucking, that sort of thing, really affects things on a practical level, like posture.
Okay.
And you can see that very clearly. So later in life, that will have a ramification in that way, for example. But there's many other things. Possibly more on a psychological level, which are much more difficult to identify. I mean, you mentioned about your own regression with the birth. So the fact of your father leaving, or that babies do remember the whole setup. And I've seen things, for example, with people working in the States with people going back to their births. For example, there was a video I saw recently with a little girl who was very distressed and angry with her mum. And she took her to this birth psychologist, and basically what he in the studio he had a little sort of Lego set of a mum and a baby, and all the sort of medical stuff, and she put it all in the right place that it was at her birth, and I mean, it was extraordinary how she could obviously consciously remember it.
Yeah.
So we do hold those things. So psychologically, there's a whole thing out there, but also in terms of imprinting in our nervous system, that's quite a big thing, and that's a little bit more difficult to identify, but you can see it when you work with babies. Say, for example, a baby, when it has a traumatic birth, will tend probably, in some cases, to go more towards what we call a parasympathetic response, which tends to be more dissociation. Okay. It's like, oh, this is way too much for me. I'm out of here till this all settles down. You know what I mean? That's kind of a dissociative thing.
And that, I guess, could show up in someone's life through not really being in touch with their emotions and dissociating from themselves. Would that be accurate?
Yeah,
or am I taking that too far?
No, I think the tendency is for us then later in life, when we get in a stressful situation, we tend to go back to those early patterns. So and you can see that in why is it, for example, that some people when they get stressed tend to go more to an angry, sympathetic, aggressive response, and other people tend to dissociate. You know what I mean?
Yeah, absolutely.
And sort of become quiet and withdrawn and fearful. So that's a question.
Yeah, and I think the thing is, if what we did worked in as much as we survived, then it worked. So it becomes conditioned, and we keep on doing it.
It's a very primitive response that we have hardwired in us, from very early on.
And if we have those kind of traumas and also traumas later in life, I think often the assumption people make is that it's going to be resolved through talking therapies and that kind of thing, which I had their place. But I think often also working on more this level can also be very, very powerful for working with trauma.
Yes, it is. And I work a lot with people who are going through psychotherapy as well, and it really helps. The craniosacral help really helps to integrate it on a physical level for people, and also will speed it up.
Right.
You know,
Right.
because when you put your hands on somebody, it's a very, very intimate thing in a way.
Yeah.
You know, it really the whole thing about just touching brings up stuff for people about intimacy and contact and relationship. So just the fact of you doing that will initiate a certain response. But on the other hand, we have certain skills, and that's why the training is, you know, quite a long time. It's great.
It's not just touching then.
No, it's not just a weekend course. So we're talking about a lot of training.
Yeah.
And then a lot of the training is to do with, you know, understanding the physiology of how the nervous system works and how it responds to touch, and then how to work with that in a way that is not overwhelming for somebody. Yes. So there are certain signs when people are getting, oh, this is, you know, too overwhelming, and then that's not useful for them.
Yes. Yes.
So it's how to mostly actually slow things down for people and integrate.
Yeah.
And so there's a lot of the training is to seeing what the signs are.
Yeah.
And how to work with it.
Yeah.
And it's a very physical thing that you can feel, you know, through your hands when you know what to look for. So although craniosacral therapy is sometimes described as quite a physical thing, actually it's a lot more subtle.
Yeah,
than it's given credit for.
I think it sounds like part of what you're doing is you're helping people come back into themselves, land in themselves, and that feel safe and comfortable to be there.
Yeah.
I mean, we've got kind of 3 or 4 minutes left. So I was also curious as that within a lot of what we're talking about here, there's a kind of hidden assumption that the body has an innate ability to heal itself.
Yes, definitely.
That in, you know, the right condition it can do that.
Yeah.
Which I think it's for a lot of people that's quite an unusual concept, because it's outside of the more allopathic model of something, you know, it's a machine, it breaks and you fix it from the outside.
Sure.
And I was curious as to your experience from a craniosacral point of view with that.
Yes, well, it's something I see every day really in the clinic, in the sense that when you create a certain space for people, and a lot of the work is around that. How do you create a safe space, which is kind of unconditional listening for people? When you create that space for people, the body will respond and it will try and resolve whatever it's holding. You know what I mean? And a lot of it is that because for most people, they don't actually get that chance. You know, in relationship, most of the time there's an agenda, isn't there? Right. You know, you put your hands on somebody because you want, well, not necessarily want something better, but maybe there's a, you know.
I don't know what you're referring to, John.
But, you know, most of the time we don't get that sort of really open-ended listening where it's like anything can happen in a way, but it's also contained. And that's the really important thing, that it's safe, you know, for somebody to experience that and to go through whatever they need to. Yeah. And most of it is quite subtle. So that's kind of the art of it, which is easier said than done, to be honest. That's why we need quite a bit of training. It's you know, it's not that easy.
Yeah, and I was just also thinking as you were talking that touch and that kind of holding is in many ways, in a healthy mother or father and baby relationship, it's the holding of the baby as well, and that touch is so important.
Yeah,
and so many babies, I think, especially these days, especially in the Western world, don't have so much of that touch and that holding.
No, and actually the mum can do a lot of that herself. You know, I said it's difficult. Actually, it's not really that hard. It's just we don't tend to do it.
Yeah.
You know, our culture is not geared up to it. So I suppose anyone can do it, and it's really important that they do it and to become aware of it as well. Because when you create it for the baby, it's like they can heal anything. You know, the baby can go through any kind of trauma, the horrendous stuff. But if you do that, it'll heal itself.
Yeah.
You know?
Well, I guess there's a distinction between if someone's got a serious pathology or a serious thing going on, and then obviously the expert help's really important for that. But from what I'm taking from what you're also saying is the importance of touch in of itself anyway. Yeah. You know, in terms of, and touch, and, you know, I think many of us tend to, maybe especially men, but many of us tend to associate touch as a purely sexual thing, as opposed to that holding and that support and that connection and that kind of thing. Yeah.
That's sometimes difficult in relationship. That's why generally, you know, it's better when you go and see a craniosacral therapist that's not your partner. Right. You know, that someone it's different because then they can hold a neutral space for you, and that neutral space is really important. Yeah. There isn't an agenda there.
Yeah. So, great.
Yeah, it's a very sacred space actually. It's a very beautiful space.
Yeah, great. Well, look, Thank you for your time today, John.
Thank you
and John's also written a book called Craniosacral Therapy. And thank you for watching Conscious TV, and hopefully we'll speak to you again soon.